Professor Dr. Mohammadullah sir, Vice Principal sir, respected guys, and my senior junior teachers, intern doctors, assalamu alaikum and very good morning. Today's topic is the basic concept of tumor diagnosis and overview of histo and cytopathology. I am Dr. Vaisukoni, Assistant Professor Pathology. So, what are the topics that I will discuss in today's presentation? First of all, I will discuss the types of biopsy in histopathology. Next, I will tell few points about the frozen sections. Then I will thoroughly discuss the cytopathology and different types of cytological techniques and samples we receive in the laboratory. And further, I compare and contrast between the FNC and biopsy samples. And last of all, few take-home message. What is histopathology? Examination of the biopsy of surgical specimen by a pathologist after the specimen has been tested and histological sections have been placed into the class line. After operation has been done, surgeons send the specimen to the histopathological laboratory by the 10% formalin. Here I should mention that the surgical specimen or biopsy sample should be fixed with 10% formalin. It is the ideal histotic. And the container should be wide mounted and should be completely submerged. And amount of formalin should be at least 3 times more than the size of the sample. After receiving the sample, we will do the 24 hours fixation of the sample or overnight fixation. After fixation, we will do the grossing of the sample. Here you can see the kidney tumor and right side you see the lung tumor. After glossing sections, we will do the tissue processing and doing the paraffin embedded blocking. After that, microtome sectioning, then deparaffinization by water oven. After that, hematoxylin using stain, and followed by microscopic examination, and report is prepared. So you can ask me how much time is required after the sample received into the laboratory. At least 72 hours is necessary for histopathological reporting and maximum 5 to 7 days is necessary. So what is biopsy? A mass or piece of tissue that is taken from the diseased organ for histopathological examination. There are many types of biopsy. Here you can see in your right side that is MRM sample, modified radical mastectomy, and this is the lumpectomy specimen in upper. What is excisional biopsy? Removal of the entire lump of the suspicious area. Here you can see the excision of lymph node. In case of lymph node biopsy, here we have to remember that if we suspect a case of lymphoma, we should excise the whole intact 1 or 2 lymph node. And lymph node should be handled very cautiously because it can easily crushing artifact, and it should be fixed immediately as soon as possible after the excision with 10% formalin. Otherwise, it will pathologize. Because in lymphoma diagnosis, we have to see the follicular architecture as well as red stain but giant cell present or not. Incisional biopsy, part of lump of the suspicious area, here you can see. Then special type of biopsy known as true cut biopsy. We will do it by a true cut biopsy or a special gun biopsy, here you can see. This is the endoscopic and colonoscopic biopsy from the stomach or colon. It is usually done by the gastroenterologist or the hepatologist or surgical oncologist or as well as general surgeon also. This is the ultrasound guided or CT guided core biopsy from the liver, spleen, kidney, abdominal organ. A CT scan is much better for the lung and intestinal lesion. Why it is better? Because it can precisely locate the small sample, and ultrasound cannot determine the peripheral lung lesion because peripheral lung tumor and the normal lung tissue cannot easily differentiated by ultrasound. But in case of intra-abdominal lump like liver, kidney, ovary, retroperitoneal lump or retroperitoneal mass or pelagic lymph node, the ultrasound guided core biopsy is much better. Why it is much better? Because it is a real-time imaging. When we will do the guided FNEC or core biopsy, we will guide the needle and bypass the major blood vessels, and as well as we see in the monitor how much the structure is pierced by the needle. This special loop electroexcision procedure and colposcopy guided biopsy this is very popular technique by the gynecologist doing the cervical biopsy. And this is a special type of biopsy known as the cell block technique. যদি আমি সহজ কথায় বলতে যাই তাহলে এফএনএসি স্যাম্পল থেকে যদি খুব সহজে সার্জিক্যাল বায়োপসি ব্লক তৈরি করতে চাই তাহলে the choice of option is the cell block techniques, যেখানে সার্জারি or বায়োপসি নেওয়া না শুধু নিডল দেওয়া পসিবল, সেখানে cell block technique is very helpful and we will do routinely in laboratory. Next one is trifine biopsy. So this is usually done by the hematologist specialist, the bone marrow biopsy known as the trifine biopsy. When the hematologist suspect or clinician suspect is a case of leukemia, lymphoma, multiple myeloma, or if there is leukemic or lymphoma infiltrations in the bone marrow, or if there is a suspicion of metastatic carcinoma, then we can do the trifine biopsy. Procedure is done by the hematologist and specimen and sample report is prepared by the histopathologist. I will say a few points about the frozen sections. All of you know that frozen section is very important and it can do the rapid tissue diagnosis during the intraoperative period. Surgeon, day before surgery, pathologists are well informed about the frozen sections and tissue sent to the laboratory, and immediately we do the frozen by the liquid nitrogen. After that, microtome sections can be done and rapid tissue staining followed by diagnosed by delivered over telephone to the surgeon into the OT, either cancer cell is present or not. So it is the urgent tissue diagnosis and definitely it is very much challenging for the histopathologist. And all of you know that in Hirschsprung disease, the presence or absence of ganglion cell is very much important in crucial moment for the proper surgical treatment, because there is a constricted and dilated path in Hirschsprung disease, where ganglion cell or hypertrophic nerve bundle is present or not. This is very much important. In case of thyroid and breast surgery, when the question is the margin should be clear or not, then we need the frozen section biopsy. There are many other advantages as well. Cytopathology. Here you can see the three-dimensional structures of cell. So the main advantage of cytopathology or FNEC sample is we look the three-dimensional and individual cell morphology in a clear view. You can see the individual cell boundary, protein nucleoli, irregular nuclear membrane, and cytoplasmic vacuoles are properly visualized in FNEC. But in case of surgical specimen, we will look in the microscope only by two-dimensional structures. But in FNEC sample, individual cell morphology is proper or well visualized. Here it is the difference between the surgical biopsy samples and the FNEC or cytopathology. So you can compare and contrast. Here the prominent nucleoli is clearly visualized, but in their cases, prominent nucleoli also present, but it's a two-dimensional structure. But there are many other advantages over the FNEC in surgical specimen biopsy samples. So what are the specimen usually you receive in the cytopathological examinations? First of all, FNEC. This is very popular technique, easy, rapid, and outpatient department we can do the FNEC in superficial and deep organ as well. We can do superficial organ like thyroid, breast, testis, and lymph node, and we can deliver the report within 24 hours. This is the ultrasound guided or CT guided FNEC from the deep lesion like intra-abdominal organ or lung and mediastinum. Here in this picture, you can see the city-guided proper localization of the nerve and needle is properly visualized within the nerve after that aspiration of the material. This is the pap smear cervical screening test. This is operator dependent because when the sample collection will be the better, the report will be the better. So we can collect the pap smear by the eye spatula into the 360 degree from the transformation zone and immediately spread to the slide, fixed to the 95% ethyl alcohol. Here I should mention that the cytopathology or FNAC sample should be fixed with 95% ethyl alcohol. Why? Because if we do not fix with the cytopathology sample with alcohol, the individual cell morphology will be lost, and as soon as possible, it should be fixed with alcohol for the FNAC material. So exfoliative cytology from the pleural peritoneal fluid cytology, sputum, urine, bronchial pus, gastric wash. There are some abrasion cytology as well as like bronchial pus wash and bronchial lavage is a very popular technique by the respiratory specialist. Another one is the special cytology technique we know as imprint cytology. Where the frozen section is available, we do as well as imprint cytology. We will collect the surgical just cell collection from the field and do the immediate slide sprayer into the slide preparation followed by 95% alcohol fixation and immediately staining, short staining followed by microscopy. Therefore, we can say that either cancer cell present or not beside the frozen section. Where the frozen section is absent, we can do imprint cytology alone. It can help the surgeon in the operation table. There are some advantages like FNAC is simple, easy, rapid, cheap, multiple areas of sampling can be done. We can sometimes bypass the tissue biopsy where the tissue biopsy is contraindicated and it has definitely sensitivity and specificity. So the sensitivity specificity in FNAC cytology samples in different organs are different. In case of breast, the specificity is around 80%, but in case of core-needle biopsy, the specificity is more than 92%. So how we can compare between the biopsy sample and the FNAC material? So first of all, tissue architecture. So in surgical specimen, we can do the proper identification of the tissue architecture. Here you can see the epithelial tissue, connective tissue, muscle tissue, nerve bundle, blood vessels. We can easily appreciate it in biopsy sample. But in FNAC sample, individual cell models are seen, not the surroundings. The ENT surgeon better known about the follicular carcinoma diagnosis. Because in follicular carcinoma diagnosis, it is mandatory to see the capsular vascular invasion. Because without the full capsular invasion, one cannot diagnose follicular carcinoma. So capsular vascular invasion only be diagnosed by the surgical specimen or biopsy or excisional biopsy. This is a case of in situ. In left side, this is in situ carcinoma. In right side, invasive carcinoma. So what is in situ carcinoma? Means that this plastic cell remains within the epithelium. Here you can see the basement membrane is intact, but in case you can see this plastic cell invade through the basement membrane into the stomach. So this is invasive carcinoma. So all of you know the malignancy has two important criteria. One is invasion, another is metastasis. When invasion is present, no doubt that it is a malignant tumor. But you can ask me that here there is no invasion, but you can see carcinoma. Yes, it is non-invasive carcinoma. We can also say that it is in situ carcinoma, especially in case of cervix, in case of urinary bladder. We found in situ carcinoma. It is diagnosed only by surgical specimen, surgical biopsy, not FNAC. And individual cell morphology, I have discussed it earlier. So immunohistochemistry, what is the role of immunohistochemistry in case of tumor diagnosis? Not all malignant cases need immunohistochemistry. Sometimes where the pathologist will fall in problem, some tumor diagnosis as well as polydifferentiated carcinoma, sarcoma, melanoma, lymphoma, sometimes we fall in problem because all look alike under the microscope. In that cases, we will do the immunohistochemistry by the marker, surface marker. Suppose epithelial marker is cytokeratin. If cytokeratin is positive, then we can diagnose this a case of epithelial origin of carcinoma. If desmin or myod1 is positive, we will suspect this is a case of sarcoma. And with LCA or CD45 is positive, we suspect this is a case of lymphoma or lymphocyte originated tumor. And when HMB45 is positive, then it's a case of melanoma. So it can help in diagnosis. Not only in diagnosis, it can help in prognostic purpose as well. All of you know that the ERP and HER2, this is very important for the prognostic purpose in breast carcinoma. Because when ERP is positive, prognosis is much better, and when HER2 is positive, prognosis is bad for the breast carcinoma. As well as it has therapeutic application as well. But not all malignant tumors need the immunohistochemistry. Only selected cases. So, take home message I want to share that clinical data is very important for the accurate diagnosis for the histopathologist. Without data, specimen identification will not be possible. Sometimes we received in the laboratory that named tissue for the histopathology. So, I want to mention that the tissue for histopathology exact clinical data is absent here. What kind of tissue? Bosundara facial tissue it is. So you should please mention exact the name of tissue and site of specimen. Definitely patient particulars is very important. Name, age, sex, if possible, phone number. Exact mention, please exact mention the laboratory investigation. Which one do you want to know? Do you want to only histopathology, or if you suspect it can be case of fungal disease, then please mention do histopathology and fungal staining. Then I will do pyritic acid shift stain. I will do the silver stain for proper identification of fungus. If you want to know the diagnosis of the, it may be case of organisms oriented, then I will send the specimen for the transient sensitivity. If you want to know about the leishmaniasis, please mention the histopathology with leishmaniasis, then I will do the needful. So site of specimen should be mentioned. Sometimes we receive that type of line from the junior doctors, a specimen for the biopsy. So here the name of the specimen, site of the specimen is absent. So when I phone the patient, can you please tell me from which the tissues has been taken, and is there any previous FNC has been done? So patient replies, "Apni FNC report dekhi korben, nakal korben." So I feel embarrassed in that situation. That's why I request to all the clinician and surgeon, please mention the surgical, especially intern doctors. I especially mention the intern doctors. Please write down the name of the specimen and site of the specimen and relevant. Here is the typical, and it may be the standard histopathological requisition. If you want it, I will deliver you. I will give you the histopathology requisition form. Please fill up the form, exact sign, and send to the histopathological laboratory. That will be better for the reporting. So in short, history, relevant investigation, in case of bone tumor diagnosis, please mention the X-ray finding, and if you clinically suspect some kinds of disease, please mention it. And in case of the different types of biopsy, please mention what type of biopsy you are doing. Please mention it. And in case of intraoperative findings, if you want to share me during the operation table, there are fixation with the surrounding structures, there are huge hemorrhage, necrosis is present, then please mention a few lines about it. It will help in your patient, it will help in the histopathological reporting. And in case of skin disease, please mention the clinical diagnosis, because it's a very vast chapter. If you don't mention it, I will be very much puzzled about the diagnosis. And plan of treatment. If you want to do margin clearance, do the margin, ligate the margin with the suture material like silk, prolene, short thread, long thread, upper margin, middle margin, lateral margin, superior margin, inferior margin. Then please mention it. Then I will mention in my reporting which margin is free or not or involved. So I want to show you a short video clip regarding a collection of 4 biopsy samples, we will do the histopathological analysis. Here you can see the 4 biopsy events, gram biopsy. This is very much easy technique to collection of the surgical samples without any operation. It's a minor surgical procedure. Before that, we can take the editing informed consent. After that, we do the proper aseptic precaution and collect the 4 biopsy sample. It was a case of intrabrilliant vacancy performed by me, and immediately after collection, it will be fixed with a 10% formalin as soon as possible. Otherwise, it is very difficult because tissue will be localized. So this is the 4 biopsy sample. So thank you very much for patience hearing.